is Jetball Network Entertainment. This is your girl Yetunde Ifelo Thomas, aka Miss T. Once again, I'm live here with another lady that she's gonna enlighten us on living with sickle cell disease. Can you introduce yourself to us?
Yes, my name is Opemi Boadetose, and I have 23, and I have sickle cell.
Okay, so 23 living with sickle cell. Wow. So can you tell us what it is like to live with this disease?
Yes, I can. Some days are good and some days are bad. It's to live with the disease is you can have some ups and downs, but if you know your limits and everything, you drink water, take your medicine as you should, then you'll be okay.
Okay. So for viewers out there, sickle cell disease is abnormal red blood cell, and it has to do with genotype of two parents or two men and a woman. And when they come together, the genotype that is donated by each one of the parents is S, then they are bound to have a sickle cell child. And if they donated AA from their genotype, which is an A or AS, if the mother and the father donated a genotype AA, then the child is bound not to have any, so they're good. So if they have AS, it means they have the trait. For our clients here, it means that both parents donated SS, the sickle cell trait, and one that is dominant. So, what are some of the challenges that comes with living with sickle cell?
Some of the challenges are it could affect your job, school, and everything. Hanging out with friends, Yeah, it's not something that you could just say, oh, the pain's gonna happen today. It comes when it wants and goes when it wants. But we can overcome it. Yes.
Okay. Can you tell us some of the things you do to keep yourself hydrated, to keep yourself in shape? Because you look good. So can you tell the viewers watching you what are some of the things you do to be healthy?
Some things that I do, I stretch, drink water, sometimes, not all the time, like I'm supposed to, but I do keep hydrated as much as I could. I dance when music I like, not the music that my mom always choose. I hang with my friends, I go on a walk, I go to the park. I just do little things that I know won't stress me, I know won't put a lot of pressure on me. So when I come back home that I'm good and I don't have to be in so much pain.
Okay. So can you tell us what it is like to be in the hospital when others are not?
Yes, I can. It's not fun. You don't have all your friends coming to visit you all the time like they would come. Like we would all drive and hang out at the movies. You don't get to go out, experience the summertime, the beach and everything. You only see pictures on Instagram and Facebook like, oh, I wish it was me. And now due to COVID, they're not even letting your family come to see you or anything. So it's not fun being in the hospital. It's very, very lonely. You only see the same people, the same nurses, and the same people who come and see you. So, yeah, I'm very happy that I'm not in the hospital.
Okay. So what advice and encouragement will you give to viewers out there who has the S trait, who are in love with each other, who wants to be together in marriage? What will you tell them based on your experience?
I would tell them it's not a good idea because your child may have sickle cell, and you wouldn't want your child to experience the pain that you went through or anything. and it's not fun to be in pain. And there's a lot that comes with sickle cell, so it's not going to be fun. Like, just be friends. Go somewhere to AA if you have SS or AS, please.
Wow. So, looking at all complications that come with sickle cell, what are some of the hopes that you have, and what are some of the encouragements you will give people out there who have the same disease process?
The hopes that I have and some encouragement words is, well, I just hope that they find a care very soon, or, they find a very good care. Not something that doesn't work with everybody, And words of encouragement, you can do it. Don't let the pain defeat you. Fight through. It doesn't last forever.
So, can you tell us what has motivated you to be this far, and what are some of the things that really give you the courage to keep pushing?
That's one of it. I look at myself that, I have sickle cell, but, I don't let it put me down, because I know some people that also have it and they're doing just fine. I know that if I put my mind to something, will get there. Maybe later than my friends, but I will get there. I know it may be harder for me to do some things, but you have to push yourself. You have to give yourself a little boost so you can get to wherever your destination. So I don't let nothing really put me down. I try to always put myself up that it's not bad living with sickle cell. It's just painful when the pain comes.
Okay. So for viewers out there, you can hear our guest speaker today, Miss Opie. She did say that the pain that comes with it is really, really bad. However, she doesn't let it stop her. She will go to an extent when she put her mind to anything that she wishes to do. She did say, if you have to come together as husband and wife, boyfriend and girlfriends, please do your genotype. It is not a joke. Make sure you know your genotype. Make sure you know that you're not carrying the trait. A trait by both parents causes someone to have sickle cell. And trust me, it can drain you. It can drain the parent. It can drain the child. It can handicap the whole family. 1 minute is rosy, 1 minute is not. Having a sickle cell full blown, trust me, it is considered being an handicap in the United States. Because there are some things you cannot do. It can cause loss of organs. It can cause you to do so many activities that a normal person can do. It doesn't have a time factor to it.
Yes.
It just happened suddenly. You can just be in a pool and coming out of the pool you're in excruciating pain. You could be having a good time dancing, like she said. She loved to dance, and all of a sudden, there's a pain. So please, parents, please, please, please. We're going to be talking more on sickle cell, and this is just to jumpstart this topic. Yet Boy is going to be spending a whole lot of time on this process, and this is one of the main one that we're going to be doing. We will be talking about people with sickle cell, living with sickle cell. Back in the days, they said the extension of it when I was growing up is 21. But thank God for advanced technology in medicine. Things are getting better. People are living up to the age of 80s. I've seen 84. If you do the right diet, if you keep all your medication regimen and you take them as is being given, trust me, you can live longer. Hydration, hydration, hydration. You have to get yourself hydrated. In third world countries, people with sickle cell are not being managed well if they don't identify it immediately. Some of them, if they live in poverty, then most of them do not attain to 21. Some died during toddlers, some died when they're infant, and some died before age 2. There are so many complications that come with it. It could cause someone to be paraplegics. It could cause ulcer to the lower extremities. It could cause loss of organ. It can damage kidney, whereby one has to be on dialysis. It can do so many things. It affects almost all the organs of the body, and more so, it makes you to. It leads to failure to thrive. You know, you can look smaller than your age group. It doesn't make you not as healthy as them. However, it does causes delay in growth, delay in puberty. So some things that people can attain by age 13, 15, 16, some people will not have it until late in their years. There is stigmatization to this disease, especially with people of Nigerian. I would say that we really need to research more. This is a disease that is very rampant in that very country. At least about 70% of people have the S trait, if I don't want to exaggerate and say 80. So please, let us find a way to decrease this disease among ourselves so our children doesn't suffer for it. When we are in love with each other, we really don't think about what is going to come after it. So which is selfish interest. So let us please, please, please do genotype so our children doesn't suffer for it. Not every parent can live with sickle cell. Some men will leave some women alone when they find out that the child they had together have sickle cell. So please think very well. I've always been an advocate for people. You have to look at the kind of spouse that you are going to have. You have to look at the kind of person that is going to be your significant other, or maybe your friend that you want to have a child with. Is he going to stay there? If you're in Africa, if you leave the child, would they be able to take care of that child or the children? It is not promising. Every pregnancy is a 50% chance that it will have sickle cell. Back in the days, they would say one will have it, the second one will have it, the third one will not have it, and then the fourth one will have it. But I will tell you, based on experience, nobody knows. There are several technologies now being done when you're pregnant. They can take the amniocentesis fluid and go through your navel and take a little bit and test it, and then they can just abort the child if the test, the procedure comes back and the child have sickle cell. But how many of us can go through that? I can't. I don't know if you can. So please, 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 instead of going through all this torture in life, instead of spending time in the hospital, instead of making innocent children stay in the hospital and, you have to work at the same time, let us try to abate this disease however way we can do it. I'm calling on Nigerians. We are well educated, trust me. Even in the United States, we have the most percentage of going to school. You can see an household of a Nigerian person in America with just associates. Many of us have masters. Many of us have doctorates. Now that we're now having all these online courses, trust me, I've had so many friends who are now advanced nurse practitioners. So please, let us advocate. Let us go out there. Let us contribute to build an advanced technology institute that can take care of disease processes such as sickle cell disease. Like I said, we're going to be talking more on this disease. We're going to go in depth of what an abnormal red blood cell is. When the red blood cell is supposed to be O in shape, a sickle cell is C. And when they go in crisis, they anchor each other, whereby they causes pain in the vessels. So there's no flow of blood in the vessels. And then the sickle cell, which the sickle shape of red blood cell, which are premature cells, makes the blood not to flow well in the bloodstream. It can cause lots of body limbs. It can cause CVA when there's not enough oxygen in the blood. Then a lot of things can happen. Do you want this to happen to you? Do you want this to happen to your loved one? Do you want this to happen to your child? Do you know what sickle cell is? So I'm challenging people out there to go and Google what sickle cell disease is. So please, 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 it can cause us a lot of complications, lots of oxygenation to the brain. It can lead to aneurysm. It could cause untimely death. It could lead to people that are supposed to live to an advanced age. It can limit their lifestyle. Yes, with advanced healthcare system, things are working better, but I would tell you this, please, 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 find a way to be an advocate, be the voice to stop marriages from happening between people who have the S trait. I was a victim of it. I know I know that I have a genotype of a trait of S because my father told me, my parent told me, but unfortunately, my significant other did not know. And in fairness to him, he was not told. So now we have children that have the disease. Do I regret having them? No. They make me who I am today. They make me to be a strong woman. But can everybody go through the same? No. The answer is N, no. Not everybody can live with sickle cell. It can cause a whole lot of breakage in marriages. It can cause a whole lot of tension in marriages. It can cause a lot of things that's supposed to take 10 years to happen, and it will drag it to 20 years, depending on how hard this disease hit the family. So please, please, viewers out there, do your best. Do your best the more you can, and just go out there, evangelize, preach the word. We have some house of the Lord that they have to do testing, I was told, like redeemed churches. When I was growing up, I would say, who does that? Please make sure it's done. Yes, nobody can stop you from marrying whoever you want to marry. But can you live with it? Can you live with sickle cell? Please Google, it's called sickle cell disease, SCD. We have different kinds. We have the SSC, we have the thalassemia ones, but you can Google it. We're going to talk about it one after the other. But the sickle cell disease is very, very, very chronic, and is not something that has a cure yet. For now, they have transplants. And when they do transplants, if the body rejects it, that person will die. The effectiveness of it right now is like almost 99% if they have the right match. But there's a lot of researches out there that they have to use different kind of donors, and they can use siblings. They can use their marrow. However, if it doesn't match, or if the body fights against itself, then the person is gone. It can make a male child sterile. So there's a lot of complications that come with it. And if you have to go through the process, they have to give some anti-cancer medications to destroy the marrow of sickle cell in that person's body. And then they will use the marrow of the new person that we're going to transplant, which takes a minute. 6 months to a year. That child, that person, that individual might not be able to come outside. They have to really, really be under the microscope. We have to do a whole lot of things. We have to make sure we're abiding, washing, and, making sure everything is clean, toe. So please, 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 advocate. Sickle cell disease is no joke. Having a S trait, please do not lie to get under the pants or underwear of somebody. Be truthful. Trust me, it isn't worth it to bring a child to the world that will suffer pain every time. This is Yetball Network Entertainment. We're here just to discuss this briefly. We're going to go more into it, And trust me, we're going to give it a break so we can give you time to digest this. And trust me, we are live and we're not going to take calls today. We will take calls another day when we're with a doctor, that is going to answer more questions with an advanced practitioner that is going to shed more light to it. However, we just want to let you know this is Yetbook Network Entertainment. Who is who in the community we serve? Who are you? Are you confident to tell us who you are? Are you confident to advertise your products? Are you confident to tell the world about yourself? So please do not judge the book by the cover. Do not judge why we are discussing this. Do not judge why we bring Miss Opie live. Please don't look at what we're doing wrong. Look at why we're doing it. Who are we going to impart with this little time we've come out? So please, please, please. Our callers 240-595-1802. That's the office number. Or you can reach us a backup number 240-605-0133. If you're out there watching us and you think you have what it takes to be out here, please give us a call and we will be happy to produce and promote you. It doesn't take no money. It doesn't take nothing. We're out here to promote people and to let people know who you are. Thank you and see you again next week. Your girl, Miss T.